COVID cases are ticking up, but so far hospitalizations have not approached rates we saw in surges over the past few years. But data shows one age group is not following that trend.
Here to answer questions, Dr. Shira Daron, the hospital epidemiologist at Tufts. Dr. Daron, thanks for your time.
Good to be with you.
All right, nationwide, the hospitalization rate among seniors has been at least 4 times higher than the average. So that sounds pretty concerning, is it?
You know, we have always known that age is the most important risk factor for severe disease associated with COVID. But we also know that the U.S. definition of a COVID hospitalization has been losing its meaning over time. Now, other states don't do this, but in Massachusetts, we have hospitalization data broken down by whether or not the patient has received treatment for severe COVID. And at Tufts Medical Center, we're actually seeing that the proportion of COVID hospitalizations who've received treatment is at an all-time low. So the news may not be as scary as it appears.
Okay. And Dr. Daron, I know we've talked before about the relatively low number of people 65 and older getting the most recent bivalent booster. But as we head into the thick of winter this season, would this make a real difference?
You know, for older people, especially ones with underlying medical problems, even a relatively minor respiratory infection can set off a chain of events that can lead to problems. And since we don't have clinical trial data to tell us exactly how effective the new booster is, you know, I've always felt that we should be focusing our booster campaign on those highest risks. Now, there's new data from CDC that shows that a lower rate of hospitalizations is being seen in bivalent booster recipients in that older age group. Although, as I mentioned before, that hospitalization data is really hard to interpret. So there's a lot of uncertainty. But what's clear is that the more at risk you are, the more you stand to benefit from that booster dose.
All right, Dr. Daron, I'm kind of really curious to get your take on this next question for 2 reasons. So Boston schools are talking about bringing masks back for 2 weeks after the winter break as a sort of virus buffer. I can guarantee, I bet there's a lot of parents who might be questioning that policy since we know COVID doesn't really overly impact most children. But what about the seniors among us? Should we be wearing masks around them? A lot of families just gathered or are still gathering this holiday week. And should we encourage them maybe to mask more when they go out? So kind of a twofer on that last question.
You know, there are many different factors that individuals, even seniors, will use when they think about what steps they want to take to avoid respiratory viruses. Some will avoid gatherings, and others will rightly say that being around loved ones is too important to forgo that. Some will wear masks everywhere, even around family. Others only when they're out in public. Others never. That's now a personal choice. I think people should talk to their doctor about what their level of risk is, all the different ways to lower it. That includes masks as one small piece, vaccination, of course, hand hygiene, but also optimizing that underlying health by controlling chronic diseases, nutrition, sleep, exercise, stress management. There's so much more, and it is time we think more holistically about health as more than just the avoidance of viruses.
All right, Dr. Daron, we thank you so much for your insight.
Thank you. Happy holidays.
Thank you.
All right, into our